So thank you for inviting me. I pulled together kind of what I think is the current state of our knowledge of the relationship between COVID-19 vaccination, and reproductive health. So I wanted to start by kind of reminding us what we know about COVID-19 infection and pregnancy outcomes. And this comes from a really nice systematic review in the BMJ that they're actually updating every few months. So they're calling this a living systematic review. And they currently combine over 100 studies. And so this data suggests that compared to non-pregnant women, pregnant women are more likely to have ICU admissions, invasive ventilation, and ECMO if they are infected with COVID-19. And then when we look at maternal and perinatal outcomes, we see that pregnant women with COVID-19 are more likely to have maternal mortality, ICU admission, as well as preterm birth. And for perinatal outcomes, we see a higher risk of stillbirth, neonatal death, and admissions to the neonatal care unit. So we know COVID-19 infection is bad for women with pregnancy, and it's bad for neonates. So probably some of you have kind of heard there's some rumors circulating around whether or not vaccination influences fertility. So I wanted to start by kind of the end message, which is there's no evidence that COVID-19 vaccine will reduce your chances of getting pregnant. And then I'll walk you through what that evidence is. So where did this misinformation come from? So in around December 2020, there were Facebook posts that started to be circulated and were widely circulated that suggested a link between the spike protein that's formed by receiving the mRNA vaccine and blockage of a protein that's necessary for the formation and adherence of the uterus to the placenta. And this claim was part of a formal petition that was filed by 2 German doctors to the European Medicines Agency on December 1st, that the goal of this petition was to suspend all COVID vaccines in Europe. Now, it turns out that both of these doctors, perhaps unsurprisingly, have been known to be anti-vaccine in the past and have also spread false information about other infectious diseases in the past. And scientifically, there is a protein that is critical for placental formation, and it's critical for the placenta to remain attached to the uterus and act as a source of nutrition and blood supply to the fetus during pregnancy. But this is not the same protein that is known as the COVID-19 spike protein. And so if this were the case, if this were to be true, which it is not, to be very clear, we would expect to see higher rates of miscarriage among individuals who had become infected with, who had become infected with COVID-19. We'd also expect to see higher rates among those who had been vaccinated. So what did the vaccine trial data show? So here I'm showing you data from kind of the 4 big trials that we have data on. I wanted to make clear that all of these trials specifically excluded pregnant women, and they had very clear consent forms encouraging women not to become pregnant and to make sure they were using contraception. However, there were surprise pregnancies or accidental pregnancies that occurred equally between the control group and the vaccinated group. And when you look at the incidence of miscarriage between the control group and the vaccinated group, we do not see a difference. So what do the vaccine surveillance data tell us? So these are slides taken from a V-Safe presentation on March 1st, summarizing the V-Safe data through February 16th. So probably many of you at this point are familiar with the V-Safe program. You've heard of it when you went to get your own vaccine, but essentially it's a program through the CDC based on self-report and text messaging where the population of the US can report their experience with the vaccine and vaccine safety. And they now have information on over 30,000 pregnancies, although I expect that to be much larger now since this data is over a month old at this point. They have not released new data yet. So one of the concerns with vaccination and reproductive health are the side effects associated with the vaccine. So some of us may have experienced these side effects or heard of people with these side effects. But for pregnancy, one of the side effects that we're most concerned about is fever, because high temperatures, especially in the first trimester, have been associated with adverse events. And so this is showing data from Pfizer dose 1 and 2 and Moderna dose 1. They didn't present data at this point on Moderna dose 2, given kind of the timing and rollout of the vaccines. They hadn't collected enough of that data yet. Pregnant individuals are in the blue and non-pregnant individuals are in the orange. And you can see relatively similar patterns of response to vaccines between pregnant and non-pregnant individuals. And for fever, we see relatively similar patterns. So we are not concerned of a higher risk for fever among pregnant individuals. So in addition to V-Safe, which is this very large and very kind of low touch, I would say, program where they're texting every few days after your vaccination and then weekly after that. In addition to that program, the CDC has started enrolling pregnant individuals who identify as pregnant to V-Safe into a specific pregnancy registry. And this pregnancy registry will involve longer-term follow-up of these women, as well as linkages with the medical records and additional questionnaires. And as of February 19th, they had enrolled nearly 2,000 participants. And there had been 275 completed pregnancies and 232 live births. So here are data from that kind of more specific pregnancy registry that the CDC has. And they looked at various pregnancy outcomes, pregnancy complications, as well as neonatal outcomes. They also present background rates. So these are background rates that the CDC would expect for these adverse outcomes. And as you can see, there's really no meaningful difference between what we would expect for background rates and what we're seeing in the V-Safe pregnancy registry overall. So the last thing I wanted to talk about is some emerging research about maybe a 2-for-1 deal we can get with vaccination. So are we able to pass antibodies in pregnancy or during breastfeeding to the neonate? And actually 3 preprints came out recently suggesting that antibodies could be passed to the offspring. None of these, I believe, have been peer-reviewed and published at this point, but they all are available on various preprint servers. This is one of the largest studies that looked at 84 pregnant and 35 lactating women. They found that vaccine-induced immune response were equivalent in pregnant lactating versus non-pregnant women. So they saw no difference between, women who are non-pregnant and women who were pregnant in terms of their immune response. And all of the titers were higher than those induced through natural immunity through infection. So that's another good sign. Vaccine-generated antibodies were present in all umbilical cord blood and breast milk samples. So there's a suggestion that biologically this can be passed. SARS-CoV-2 specific IgG, but not IgA, was increased in maternal blood and breast milk after the second dose vaccine boost, and there was no differences were noted across the groups. So the conclusion was that the immune transfer to neonates occurred via the placenta and via breast milk. So this is exciting news. I think we need more research on this. I think there's a lot of things we can learn from this, but it seems that we could get a positive side effect, which is passing antibodies off to the neonate as well. So my conclusions from this literature are that COVID infection does increase risk of adverse pregnancy outcomes, but COVID-19 vaccination does not negatively influence fertility or pregnancy outcomes, and vaccination during pregnancy or while breastfeeding may allow antibodies to be passed to the neonate. I'm leading some ongoing work on this topic in the Arizona cohort study, so we should be seeing some interesting data, mostly on women who are trying to conceive and how COVID is influencing their ability to conceive. And that is all I have. So hopefully that was the scope that you were hoping for. I'm going to stop sharing my screen, but I'm happy to share these slides and share citations if people would find that interesting. And thank you, Casey, for your comment. So very young infants have a higher risk of severe disease. So the fact that we can pass antibodies on to the neonate could be really fantastic news for prevention.
This is wonderful, Leslie. Thank you so much for taking the time to present. Any questions or comments?